The lessons that must be learnt from the pandemic. Former Victorian Health Minister. Yeah, he's walking back some of the issues that they did. And has cost it is costing the future health of Australians because of issues and the overreaches. And people were claiming Victoria's overreaching anyway. Just so happens it's a Victorian guy coming out and speaking. Um, according to so this whole knocking elbows instead of shaking hands, everything needs to be disinfected. According to the man who led the charge, it was a waste of time. Really? I thought we believed the science. At least that's what we told we were doing. Huh. So the people who said it was largely propaganda or that it was largely politically driven overreaching, who had their voices suppressed, as we saw in the earlier articles, that yes, Facebook and Google quite willingly stomped all over the dissenting voices for no other reason than they felt like it, and because the government, i.e., the Biden administration, asked them to. So there are other ways that could have been managed, and well, hand sanitizer kind of work, but yeah. He argues that well, another pandemic is inevitable. Yeah, well, that's going to happen. We know that pandemics happen from time to time. The Chief Health Officer engineered Victoria's COVID-19 strategy, which is one of the toughest in the world. So yeah, the Melbourne lockdowns were notorious even at the time. So touching elbows, probably never necessary. The things we learn as we go, no, they're not. This was known. It was anybody who listened to what the CDC had to say and watched them waffle back and forth and listen to the Chief Health Officer's waffle back and forth realised there was a lot of uncertainty. And not only that, there was a lot of bad science that was being pushed forward as gospel truth. And they overemphasized surface contact as opposed to breath, but at the same time, there was the memeing of COVID only. I'm immune to COVID if I'm sitting down and eating. Yeah, right. Or I'm immune to COVID if I'm protesting. No, you do have to wash the groceries for other reasons. There's other diseases are born on fresh fruit and veg, and you want to keep the pesticides and stuff off. So yes, you still should be doing that. Yeah, more important for the infections that occur in hospitals than it is for pandemic viruses that are mostly about the air we breathe. Yeah, I mean, people. I don't know that there were people who were completely against any sort of lockdown or isolation. Well, maybe there were some people who were, but I think there were moderate voices that were saying, yes, isolate your at-risk communities, i.e. the elderly, the young, and, well, actually the young were almost immune to it. The ones with multiple comorbidities, certainly isolate when you got yourself sick. And these are sort of standard good practices whenever there's respiratory illness around. But no. We had to go way over the top and cancel and basically shut down economies and things like that. No. But that wasn't what we were forced to do, and that's what we weren't told was the good thing to do. But now, many years later, someone's obviously trying to repair reputation. The pandemic was a horror show. Wake up many mornings wanting to quit. Well, you should have been better at it. He wants to forget it. In a society, we should not. We don't talk about it much. We can't talk about it much because those who try to talk about it had their voices suppressed. They were cancelled. They were shut down. They had their accounts deleted. No. You don't get to walk away from it like that. So yeah, people were arguing lockdowns were damaging. There were points, no reason to traumatize families and things like that. Government sloppiness. Yep. Well, so yeah, New South Wales had less lockdown, more people, significantly fewer deaths. Oh, the science was different across the Murray River. Well, I should tell people that. So the lockdown to an extent worked. I said, yep, they just basically went way overboard. Instead of just focusing on the vulnerable communities. And here's the problem. And we're going to see this in a subsequent article, is we're seeing an increase in the rate of communicable diseases that have available vaccines and have for a long time, because parents and carers who are responsible for the kids getting the vaccine have basically said, no, you guys screwed it up with COVID. Don't trust you anymore. That is the bigger long-term public health failure of the COVID-19 response, is that it has emboldened anti-vaxxers and has led to people who otherwise would be vaccinating and should be vaccinating under the existing schemes. Whether or not you think COVID-19 vax is appropriate or not, by the wayside, but vaccines for things like measles, rubella, whatever else. I mean, the flu vax, yeah, a bit of a debate about how useful that is, but the routine normal vaccines, polio and things like that, people are now staying away from that because the response to this has been far more dangerous and deadly than anything Dr. Wakefield ever suggested, and The Lancet, which is the most trusted voice in medicine, published and managed to absolve themselves of responsibility in that debacle. So, yeah, it's they forced sacrifice. They made an absolute mess of it, and people were saying this at the time, but they were too afraid to speak up and say anything because even the merest hint of dissent would lead to people losing their platform, people losing their ability to say anything, really. Yes, they should do the comparisons. They should continue to do the post-mortem to find out what happened. And can't talk about the details of his health orders because there's court action. Ha! Funny that. There's always been suspicion of undue influence by politicians, i.e. dictator Dan, in his decisions. He takes full responsibility and says he was in the belly of the beast. His mistakes? A list that's too long for the podcast. No. 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 Bad signs. Bad signs. But, there are a lot of people who had powers of authority, positions of authority during the pandemic that should not have been given them, because we now have lots of people fighting battle for compensation due to vaccine injury, but to even suggest that the vaccines that were rushed out were unsafe potentially. I mean, Johnson & Johnson were forced to withdraw their vaccine. Well, vaccine. Just because it's called a vaccine. Forced to withdraw their treatment. And so, VAERS, which was the vaccine adverse effects reporting system in the US, was closed off from a public awareness because the amount of adverse effects being reported from COVID vaccination was skyrocketing. It was insane, the number of vaccine injuries and adverse effects being reported. But no, that had to be suppressed because that would have prevented people from taking it. Well, again, the whole trust the science around it went from, oh, you'll be protected, to, oh, no, you're partially protected. Herd immunity, the idea of herd immunity went out the window. And it's just like, oh. And so you've got people who've got long-term autoimmune diseases now, or permanent autoimmune diseases, because of bad effects from the vaccine, from the COVID vaccines. And so, yeah, we have people who in good faith took a vaccination because they trusted they trusted the science, they trusted the politicians, and had an adverse reaction, and were told in the unlikely event you did have an adverse reaction, you'd be supported, but not really. And so you've got thousands of people seeking compensation through the scheme, and while the scheme closed, there's still cases yet to be processed. And the process has been cruel and spiteful. Yep, because to admit that this was not 100% perfect is to admit that it didn't work very well. It's like they're waiting for me to go away because it's too hard, or to pass away. In other words, yep, it's the existence of these people is an embarrassment to the way that the pandemic was handled. And so 1/3 of your settlement would be taxed. More than 1,000 pages of it's just the burden of proof. It's just from the time they submitted to the day you got the offer of compensation, almost 500 days. Not good enough, government. Not good enough. Not good enough. So, yeah, the losses, the complexity of the scheme, that's fine. Okay, so 5,000 claims received up to the cutoff, only 500 have been approved. 2,500 claims denied, another 1,000 withdrawn. But see, that doesn't say whether the denied or withdrawn claims were invalid, just that they weren't going to process them. And potentially, because the process is complicated, they're failing for technical reasons as opposed to medical reasons. And you're asking people who've suffered with an injury to negotiate a process that's difficult for able-bodied people. It's just like, Here you go. Past 2.5 years, a florist that had 9 heart surgeries, 1 bowel procedure, 1 vascular operation, 2 dozen hospitalizations, suffers multiple debilitating complications after just 2 doses of the Pfizer vax. You see, the rate of reported injuries as well, for most proposed vaccines coming onto the market, it's insane. It's way too much. But no, again, go back to that previous article about what Brett Sutton just said. Oh no, we tried it and got bits wrong. There were people saying this at the time. People who could read the science, who could read the medical papers, and read the data that was out there. It was like, no, this is scary. There is a lot wrong with this. But no. So it just sad that it has to come to this now. I don't know that Albanese, in the current government, has obligation. Well, they've got obligation because the scheme is a government scheme, but they're not the ones who necessarily have responsibility for what took place, I guess. They've got responsibility because they are the current government, but yeah, it's just being actively ignored, quite literally. It's just, yeah. A no-fault vaccine compensation scheme. So in other words, the pharmaceutical companies and the government basically get to say, it wasn't our fault. Yeah. But if nothing else, it is surprising that this information is now being reported on in the actual media, when for a long time we're told thou shalt never whisper bad things about it. And like I said, this is having consequences. A declining rate of vaccination, of childhood vaccination schedules. Yeah, okay, some of it's out-of-pocket costs, limited appointments, lack of opportunity to discuss vaccination. Well, people wanting to make sure they're properly informed, but eroding trust. Well, why is trust eroding? Have we suddenly magically got an entire population of anti-vaxxers that, as were derided as cookers? No. The eroding trust is because of the debacle of COVID-19. That's it. And so these first ones are, if you're looking at systemic or experimental errors, or, I mean, it's just going back to doing experiments. In terms of systemic or incidental reasons, out-of-pocket costs, yeah, they're going to come and go. Some people can afford it, some people can't. Limited appointments, okay, that's kind of systemic. Lack of available healthcare, lack of opportunity to discuss vaccination with providers, that comes down to limited appointments and available time. If you only got 15 minutes to see the doc, you're not going to get a detailed response in that 15 minutes before the jab goes in. So what's the big one is this big systemic issue. Well, apart from that, but those things have been around for years. So if they were going to have a massive effect on declining in vaccination rates, you would have seen that already, or maybe it's already contributing. And so their effect is already weighted in the declining rates already. So what's then changed? What's the one that has changed? Well, eroding trust. And why is trust eroding? Well, because of the outcomes of COVID. And so I started seeing it as increased reporting of measles showing up. Now, some of it too is also some of the appearance of these communicable diseases and stuff is, well, they just appear in the society. Sometimes when we talk about migrants from other nations with poorer healthcare, they may come in with endemic diseases that the Australian community is either not exposed to or normally has an immunity to. And so the appearance of these illnesses are tied to recent migration patterns. Over time, their immune systems and healthcare catches up to everybody else. So it's more an issue of recent migration. Just a fact of life that healthcare is not the same everywhere around the world. Not blaming them, not saying, hey, don't do immigration, just accept that sometimes people coming in from different parts of the world will bring certain diseases with them. That happens. And so when the rest of your community is not immunised to the right level, the disease will spread in the community. But it'll appear sometimes based on that. Or tourists and things like that. I mean, that's why they shut down airports and cruise ships and transports when COVID hit. So 95% is the target. Yep, that's good. I mean, there's the big one. Declined each year since the start of the pandemic. I wonder why. Don't think too hard, I'll be cancelled. So coverage has remained below the national target of 95% across all standard age milestones. Catch-up vaccines is essential to protect them from potentially life-threatening vaccine-preventable diseases. Yeah, fair enough. 95% is pretty good. Now, there are some people. Now, the idea is most people getting a vaccine, you get your herd immunity in the community, and that then provides coverage to the portion of the population that can't be vaccinated for whatever reason. Some will be for cultural reasons or beliefs, and hopefully that they're going to be a small enough number. But there are people who, for medical reasons, cannot receive certain vaccines, be it the makeup of the vaccine or the fact that they have a bad reaction and know, therefore, that they can't be They won't generate the antibodies or can't receive the vaccine or whatever reason. Or someone who's received the vaccine and the vaccine has failed, but you're not going to know. So that's why it's not 100% coverage, because it just, yeah, there's always going to be a portion of the population that for some reason, either the vaccine doesn't take, can't have it, won't have it. But 95% is a really good number. But, yeah, declining. So, strategies. Increased bulk billing. Yep, that's going to help address the cost approach. Extending hours and settings for appointments. Okay, that's going to increase the availability. However, declining trust. Working with trusted community advocates to share vaccination messages. That's not going to work. For people who've declined their trust in the wake of the COVID-19 pandemic, they were told to trust the authorities. They were told to trust the science. They were told to trust we're the government and we're here to help. And that broke down. And as a result, people have had their trust eroded. And you can't just turn around and say, you've got to trust us again. We're right this time. No, you burnt that bridge. You really burnt it hard. And so it's going to take some time for that to come back.